Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
I've got eye bags under the eyes. Do I need a blepharoplasty surgery, or what else could help me?
So lower eye bags are a real common problem that I see in clinic, especially for patients in the sort of 50s, 60s and above age group. And really, what are the solutions for these lower eye bags? So they're part of the aging process. Why do eye bags occur? Well, let's look at that for a start. One reason can be it's just an aging of the skin in that area, and there's laxity, loss of elasticity, and the skin just hangs loose. Okay. In some patients, there are problems with the lymphatics. These are little channels within the skin that circulate fluid, and they get a sort of puffiness underneath the eyes. We might notice a bit of that ourselves when we're overtired or had too much to drink the night before. Then we can get these sort of temporary eye bags first thing in the morning. But that's fluid which tends to disappear during the day. Some people, that fluid stays long term or gets worse if they have allergies or problems like that. It can really swell up. The third reason why somebody might have a significant eye bags under the eyes is where the fat has prolapsed or slid out from the bottom of the eye socket. Okay, this is the infraorbital fat pad, and it can protrude out through the aging process and come forward like a hernia, like a slip disc, something pushing forward. And once it comes out, it stays out. And so there could be fat that's creating that swelling underneath the eye and that eye bag. So we've got to really work out what is causing your eye bag to work out what the solution is and the potential treatment. So for example, if it's where fat has prolapsed out and you've got excess skin there, then we can sometimes try and treat that with Morpheus 8 or Accutite, where we're trying to destroy that fat and shrink the skin at the same time. It can work quite nicely in mild degrees, but often that's an indication for surgery where the surgeon can carefully remove the fat from the eye bag and tighten and remove some of that excess skin. If it's due to the fluid collecting in the eyelids, then really we've got to try and rejuvenate the skin and the tissues, and we have to do that in a much more gentle way. So we might be just using some of our heat treatments in that way, more superficially. So like Tixel, which is a heating treatment where we're heating the skin, trying to get it to regenerate. And that with some simple massage and using some serums on the skin can sometimes help quite nicely to tighten that skin and help those lymphatic channels work better. Okay. Sometimes we're avoiding fillers in those sort of patients and anything that could interfere with the lymphatics, because that could seriously make things worse. But if it's just your bog standard aging and thinning of the skin and looseness of the skin, then we have lots of treatments that can help there, which may be enough rather than needing to have surgery like a blepharoplasty. So in the more sort of milder, earlier cases, then injecting polynucleotides or PRP into that skin can help that skin rejuvenate. Gilain of Sweden, this really powerful long-acting collagen stimulator, can really help with that skin in the lower eyelids to rejuvenate it. So if all we're trying to do then is tighten and get more elasticity back in the skin. Okay, heat treatments, Morpheus 8, Tixel, they can all help tighten the skin. So we've got to be very careful when we're looking and assessing eye bags. What is the cause? What factors are going on? And it's that really dictates whether a non-surgical treatment or a surgical treatment is most appropriate for you.